The effects of crystal meth during pregnancy. Methamphetamine is a stimulant drug manufactured with chemicals such as drain cleaner, battery acid, and ammonia. Methamphetamine's toxic makeup can have dire consequences when taken during pregnancy. The March of Dimes reports that women who use crystal meth during pregnancy have an increased risk of pregnancy complications. Meth used during pregnancy can affect fetal growth and development while presenting the child with long-term health complications as well. Prenatal exposure to methamphetamine results in structural changes in a baby's brain. In a study published in March 2010 issue Journal of Neuroscience, researchers at UCLA used MRI to examine the brains of 61 children, 21 of whom were born to meth-using mothers. Compared to normal children and children who were prenatally exposed to alcohol, the meth-exposed children showed a shrunken caudate nucleus. This region of the brain is associated with memory, learning, motivation, and motor control. Animal studies at the University of Toronto resulted in similar findings. In the August 2005 issue of Free Radical Biology and Medicine, scientists described how a single exposure to methamphetamine in mice during pregnancy produced offspring that suffered persistent impaired motor coordination. The effects lasted until the baby mice were 12 weeks of age. If meth harms your body, why wouldn't it affect the development of your baby? Methamphetamine is a central nervous system stimulant and can cause fetal heart failure, stroke, malformed organs, and other developmental problems. Meth can have an effect on pregnancy, an effect on the fetus, and an effect on the infant after birth. During pregnancy, methamphetamine causes severe changes in blood pressure and available oxygen to the fetus, causing stroke, heart attack, and premature labor. After birth, slow development, learning, and behavioral problems are typical of children with mothers who use methamphetamine during pregnancy. Meth also causes effects on the fetus, which consists of reduced blood flow to the fetus, causing malformation or lack of limbs, and organs such as the brain, the heart, and the kidneys. Meth exposure is toxic to the developing fetus and can result in lifelong brain, cognitive, and behavioral problems. Of the more than 16 million Americans over the age of 12 who have used meth, about 19,000 are pregnant women, according to the data from the National Surveys on Drug Use and Health. About half of the women who say they use meth during pregnancy also use alcohol, so isolating the effects of meth on brain development is also difficult. In the research field, Elizabeth Sow's team evaluated the specific effects of prenatal meth exposure by comparing brain scans of 61 children, 21 with prenatal meth and alcohol exposure, 13 with heavy alcohol exposure only, and 27 unexposed. Structural MRI showed that the sizes and shapes of certain brain structures varied depending on the prenatal drug exposure. Studies show that certain brain structures are smaller or larger than normal in alcohol-exposed children, while brain regions in meth-exposed children were similarly affected, if not more so. In this study, the authors found these brain regions in meth-exposed children were similar to alcohol-exposed children, and in some areas were smaller still. Some brain regions were larger than normal. The researchers were also able to predict a child's past exposure to drugs based on the brain images and IQ information. Detailed data about vulnerable brain structures may eventually be used to diagnose children with cognitive or behavioral problems, but without well-documented histories of drug exposure. Ultimately, the goal would be to come up with strategies to first minimize the brain damage in the womb, and second, to improve the child's cognitive performance. Meth addiction has grown quite significantly in the past few years. Various states have become affected by the sudden emergence of meth, which has almost taken the world of addiction by storm. Treatment centers are already working overtime preparing more effective methods to help their meth-addicted patients come out of their conditions.